Hi, my name is Octavia Russian, and I am currently a doctoral student at Toro University Worldwide. I am a senior case manager at an organization that I've been with for 2.5 years, which is Unique People Services. They service individuals with HIV. I'm going to be reading from my notes. At this time, my son currently has a fever, so I will make this quickly and informative. And I will be discussing how service research can improve human services in case management practice. Service research plays a critical role in improving human service organizations, particularly those providing case management, behavioral health, and housing support services, and agencies serving vulnerable populations, such as individuals experiencing homelessness, mental health challenges, or chronic health conditions. The quality of service directly affects client outcomes. Service research provides a structured, evidence-based approach to evaluating service delivery, identifying gaps, and implementing improvements that enhance both client satisfaction and organizational effectiveness. One way service research improves practice is by systematically assessing client needs and experiences. For example, through surveys, interviews, or focus groups, agencies can evaluate how clients perceive accessibility, communication, and staff support. Tools such as service quality assessments allow organizations to identify barriers that prevent clients from fully engaging in services, such as long wait times, unclear expectations, or inconsistent follow-up. Research has shown that understanding client perceptions is essential for improving service effectiveness and building trust, especially in trauma-informed settings. Service research also supports processes improvement within case management systems. In transitional housing programs, such as my organization, delays in documentation, housing readiness, or referrals can significantly impact a client's ability to secure permanent housing. It can impact significantly with permanent housing, but we also have supportive housing. And supportive housing is basically just like transitional housing. It's the client's own apartment, but they have case management in the building to assist them with everything that they need, mental health services, resources to primary care doctors, pharmacies, different things, job readiness programs, everything. So it's just not for permanent housing. So by analyzing workflow data, such as time to complete intakes, which can be pretty hard sometimes because some clients come in and they have breakdowns, and sometimes they don't want to talk to you about their problems while they became homeless. So that can take some time. Frequency of missed appointments or audit deficiencies. Organizations can identify inefficiencies and redesign processes. For instance, research findings may support implementing standardized checklists or structured case conferences, leading to improved compliance and smoother housing transitions. Additionally, service research strengthens staff training and professional development. Research can identify skill gaps among case managers, such as documentation accuracy, which is sometimes a problem because some case managers don't do progress notes in real time. So that becomes a problem. Medication adherence, support, or crisis intervention techniques. Some case managers come in and they don't know what a EDP is. They don't know how to, deal with the client who's going through a mental health crisis. Sometimes they just come in and they have no clue on what to do. Evidence-based findings can then inform targeted training programs that enhance staff competence and confidence. Studies indicate that ongoing training grounded in research leads to higher service fidelity and better client outcomes. Service research promotes continuous quality improvement and accountability. Using data-driven feedback loops allows organizations to monitor outcomes such as housing stability, treatment adherence, and client engagement over time. This approach not only improves service delivery, but also supports funding justification and policy compliance. Action-oriented service research ensures that interventions are continuously evaluated and refined to meet evolving client needs. So lastly, service research is essential for improving human services and case management practice. By incorporating client feedback, improving internal processes, strengthening staff training, and supporting continuous improvement, service research enables organizations to deliver more effective, equitable, and responsive services. Ultimately, this leads to better outcomes for clients and more sustainable, high-quality service systems. Thank you for listening.